Are you a first-year PUCV student? If so, protect your health. Have you felt stressed lately? Stress is a natural physical and mental reaction to life experiences. Everyone expresses stress from time to time. Anything from everyday responsibilities like work and family to serious life events such as a new diagnosis, war, or the death of a loved one can trigger stress. If your stress response don't stop firing and the stress levels remains elevated longer than necessary, it can have consequences on your health. Symptoms of chronic stress may include headaches, tremors, neck ache, back pain, or muscle spasms.
I'm so stressed!
Are you stressed? Maybe you should find things that can help you reduce your stress levels, like, for example, taking a walk on the beach, talking with your family and friends. Maybe you should also organize your time better.
Have you ever felt so anxious you can't cope with anything? Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, or giving a speech may cause most people to feel fearful. If your feelings of anxiety are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. According to the American Psychological Association, women are more likely than men to be diagnosed with an anxiety disorder. Anxiety feels different depending on the person experiencing it. Some ways people experience anxiety include nightmares, panic attacks, painful memories, painful thoughts, or fear and worry.
Oh my gosh. Isn't Robin anymore? Why? Why do you do this to me? Why? Why? Oh my goodness, what do I do? What do I do? What do I do?
If you're anxious, try to find the reason why you're feeling that way. Identifying the root may help you feel better.
Just stop for a second and analyze yourself and your situation.
Sometimes it's not that hard to make the world stop spinning around. You can always talk to a friend or your relatives.
I am sure they'll be able to listen to you.
When you leave home, do you feel like you miss it so much despite the chaos? When you're homesick, you might miss familiar things like your family, friends, pets, house, or neighborhood. You can miss something as simple as your bed or the tree outside your window. Familiar surrounding people and routines help us feel secure and relaxed. Those homesick feelings are completely normal. You might feel a little lonely, sad, or stressed. If you want to reduce this feeling, here you have some advice. Bring something that reminds you of home. Call home when you can. Stay active, talk to a friend, and write in a journal.
Hey, look at this picture my brother sent me. This is my family. Oh my gosh, I miss them so much. I'm so sad.
Oh, honey.
I really miss them.
Calm down. Okay, if you are feeling that way, you can always grab your phone and talk to your dad or your mom, even your siblings. That will make you feel so much better. If you want to reduce this feeling, homesickness, the next time you visit your family, you can take something from them and that makes you feel in home.
You're such a good friend. Thank you.
You think you might have depression?
Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home.
Also, medical conditions can mimic symptoms of depression, so it's important to rule out general medical causes. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest in activities you once enjoyed, change in your appetite or weight loss, trouble sleeping or sleeping too much, loss of energy or increased fatigue.
I can't feel it anymore. I can't.
If you think you're having depression, you should talk to a specialist. He will be able to help you, run some tests, and tell you if you really have depression or something else. Remember, sometimes you think you have depression, but maybe it's not that. so it's very important to talk to a specialist. Also, remember you're not alone.
Are you aware of how much you drink at a party? Binge drinking involves a dangerous pattern of excessive alcohol consumption. Typically, your blood alcohol concentration, BAC, will rise to 0.08% or above after binge drinking. For some people, especially those on prescription medications or other drugs, it might take a smaller amount of alcohol to reach a binge drinking level. Recognizing the harmful effects of binge drinking is the first step toward recovery. Seeking alcohol treatment will show you how to eliminate drinking from your life, as well as prevent further problems. Several harmful and long-lasting side effects of binge drinking include brain damage, liver disease, stroke and heart problems, cancer, infertility.
I'm so drunk right now. I'm really drunk.
Oh my goodness, no!
Yeah.
Give me that!
No, give it to
Give me
me.
that! Oh my goodness! Don't let alcohol lead you down a path of destruction. Treatment can be provided you with the tools and resources to help you be the best you can be. When you're happy and healthy, everything will fall into places.